After a long lull, India is seeing COVID-19 cases creep up again. In late May 2025, the active case count jumped suddenly, from just 257 on May 22 to 3,395 active infections by May 31st. That's the first time in over 2 years that active cases have crossed the 3,000 mark. In one day, from May 31st to June 1st, the Health Ministry reported 685 new cases and 4 deaths nationwide. Kerala with 1,336 cases, Maharashtra with 467, and Delhi with 375 are currently the worst-hit states. Health officials say this uptick is driven by new Omicron subvariants, specifically LF.7, XFG, JN.1, and NB.1.8.1. These strains spread more easily than earlier ones, but so far they do not appear to cause more severe illness. Most infections are mild and flu-like, low-grade fever, cough, sore throat, and fatigue. Crucially, hospitalizations remain low. Many patients recover at home. ICMR Chief Dr. Rajiv Bail notes that these variants are, being closely monitored, but at this moment, there is no cause to worry. World Health Organization advice echoes this. Even with rising cases, severe outcomes remain rare, and the focus should be on vigilance, not panic. The recent rise is a warning to stay alert. Hospitals nationwide have been asked to maintain readiness, ensuring oxygen supplies, ventilators, and medicines are on hand. This precaution comes from hard experience. During India's April to May 2021 wave, overwhelmed hospitals ran out of beds and oxygen, contributing to tens of thousands of deaths. Today's numbers are far smaller, but even mild surges can strain resources. In fact, outpatient clinics are already seeing a 3 to 4 times jump in people seeking care for fever and cough. If cases keep rising, there's a risk of renewed stress on healthcare, longer waits, diverted resources, and possible disruptions in services. Economically, higher caseloads could slow travel and commerce as people avoid crowds. So far, no large-scale lockdowns or major restrictions have been imposed. Authorities emphasize preparedness rather than panic. What can you do? Public health experts in the government are clear. Follow common sense precautions. What can you do? Public health experts in the government are clear. Follow common sense precautions. The Karnataka government's recent advisory urges everyone to wear masks in crowded places, maintain physical distancing, and practice good hygiene. The World Health Organization likewise advises, get vaccinated, including recommended boosters, stay at least 1 meter away from others, and wear a well-fitted mask when distancing isn't possible. Wash your hands frequently, and cover coughs and sneezes. Crucially, if you feel sick or test positive, self-isolate immediately until recovered. These measures are proven to slow spread without shutting down society. Vaccination remains our strongest defense. Over 95% of eligible adults in India have already received the full primary series of COVID vaccines, and about 75% have gotten boosters. Vaccination remains our strongest defense. Over 95% of eligible adults in India have already received the full primary series of COVID vaccines, and about 75% have gotten boosters. Updated vaccines targeting Omicron variants are now available for high-risk groups. Experts worldwide are even updating formulations to match the new JN.1 strain. Indian officials say the health infrastructure built in past waves, from oxygen plants to ICU beds, is fully on alert. On May 31st, India's health ministry reiterated that the situation is being closely monitored and assured citizens that there is currently no cause for worry. In summary, India's COVID resurgence is real, but still manageable. The surge is driven by more contagious but milder variants, and most patients are fine at home. We must stay cautious, mask up, keep gatherings small, and get any due vaccine dose. In summary, India's COVID resurgence is real, but still manageable. The surge is driven by more contagious but milder variants, and most patients are fine at home. We must stay cautious, mask up, keep gatherings small, and get any due vaccine dose. Stay tuned to trusted sources like WHO and India's Health Ministry for updates. Follow official advice. As Dr. Beale said, monitor the situation and be vigilant, but do not panic. By doing our part and using the tools we have, communities can stay safe until this wave subsides. Sources: up-to-date case data and guidance from India's Health Ministry and press, via news reports, WHO advice and analysis by medical experts.